So we have few minutes before we start the webinar today. Meanwhile, we have a very interesting quiz question for you all, and you can share your answers in the chat box section. So the question is, frequent urination is a possible sign of diabetes. Is this a true or false statement? You can start sharing your answers in the chat box section, and let's see how many of you get it right. So looking forward to all the answers from people from audience. So namaste, sat sri akal, salamu alaikum, and a very fresh good afternoon, everyone. This is Sanghamitra leading the chronic condition program at MeraDoc, and I will be your host for today. So as you all are aware, MeraDoc is a 24/7 holistic tech-enabled healthcare delivery platform with family physicians as gatekeepers of the entire healthcare ecosystem. Today, we are here in this webinar to know better about diabetes. And for this, I would also like to thank MedTalks and Dr. KK Agarwal's team for supporting us. Nowadays, there are many myths about diabetes and so many sources on how to control your diabetes. Hence, it is very important to follow the right path from a trusted source. Hence, we want to spread the right information so that people can control their blood sugar levels in a better way. And for this, we have with us today Colonel Dr. Sanjay Kumar Singh, who has specialization in family medicine and is currently the head clinical services at MeraDoc. Dr. Sanjay has 32 plus years of experience as medical officer and administrator and has served in various hospitals of armed forces all over India. He has also been a pioneer of medical mission in Afghanistan. We also have with us dietitian Ms. Vanshika Mathur, who has specialization in nutrition and dietetics and has been taking care of different dietary needs of our users across streams. So with this, we start today's webinar. And if anyone has any questions during the webinar, you can start sharing your questions in the chat box section. आपके कोई भी सवाल आते हैं वेबिनार के दौरान, आप चैट बॉक्स सेक्शन में अपने सवाल भेज सकते हैं. हम वेबिनार के एंड में will answer all your questions. Our experts will answer all your questions towards the end of the webinar today. So over to you, sir.
Thank you so much. Thank you for the introduction and everything, Sangha ma'am. And thank you for educating me how to use mic also. So I was trying to just I was clicking on this side, but it was basically on the left side.
No worries, it
Uh,
happens.
a very good evening to everyone, to our all listeners who have joined us for knowing the diabetes. I am thankful to them that they have taken their valuable time to understand this disease, because this is one of the disease which is causing much of the burden to the society at the present time. So with this, I will just start. Is my screen is visible?
Yes, sir, it's visible. Just a quick suggestion, sir, if you can click on the full screen at the top so
Uh,
that we can get the slide.
is it? Is it
Uh,
okay?
no, sir. It's
Is it
fine, sir. We can continue this way. No worries.
okay?
Yeah.
Okay. So before I proceed with diabetes, what is diabetes? I like to make you understand about the how our digestive system functions basically, and what happens to the food which we eat. So with this, I'll let you know that whatever food we are eating, it is first coming to our mouth, and from there itself the digestion starts. You know, you are chewing your food, then saliva is mixing. Saliva also contains lot of enzyme to digest carbohydrate, protein, and so many things. So it actually it starts from here, then it comes to the food pipe, and then goes to the stomach, and then it reaches a small intestine, where the smallest molecule which has been broken down of the from the food is being absorbed from the intestine. So in the next slide, we'll see how it is uh, being absorbed. We see whatever carbohydrate you are eating, whatever sugar which you are, anything carbohydrate which you are eating, it is being converted into the glucose, which is the smallest form to be absorbed by the intestine. So it is being absorbed from the intestine, and then it reaches to your bloodstream. When it reaches to your bloodstream, then the sugar level in your blood start to increase, and then it is being sensed by our pancreas. Pancreas is a organ in our body which secretes insulin, and insulin is the one which controls the sugar from your blood. So then when you are eating and glucose is being absorbed from your intestine and your blood is overloaded with the sugar, then this gland activates and secretes insulin, and insulin then takes this sugar into the cells. And what is cells? I will tell you. You must have seen your home. The home is usually being constructed with the use of bricks, and the bricks is the basic unit when the wall is being constructed. Similar way, our body is when it is made up of cells. Cells is equivalent to brick, you can understand. And for cell to function, because brick is a non-living thing, but the cell is a living thing. So living thing to function, they require energy, they require a fuel, and this fuel is glucose, which is being taken by the cells from the blood, and then the cells functions. So I'll give you the scenario here. If you can see here, this is the blood vessel, basically the blood which is flowing in the blood. Hope my arrow is visible.
Yes, sir. Yes, sir. It
Okay.
is.
So this is a sugar molecule, which we call it glucose, which is flowing in the blood. And when you eat, then intestine is absorbing more glucose, and you can see here the more glucose has accumulated in your bloodstream. Now, the pancreas has secreted insulin, and insulin is taking this sugar into the cells, and any extra sugar which is not being required at present is being converted into the glycogen. The liver, muscle, it is a storage form. Basically, the glycogen is a storage form of the glucose. Whenever you will be starving, this glycogen will be break down into the glucose to give you the energy. This the as In this way our body functions. So you can see here in this figure that the sugar which was accumulated here, when insulin started functioning, the sugar level is now down. I'll give it another scenario. This is the another scenario where the glucose you are seeing here in the blood vessel is less. You are starving, you are fasting, but then when you are fasting, your intestine is nothing. Nothing is being absorbed from your intestine, so it is not contributing to the blood vessel any glucose molecule. So then in that state, this is also sensed by the pancreas, and the pancreas secretes another hormone which is called glucagon, and this converts the this starts glycogenolysis, and then gluconeogenesis. Basically, the gluconeogenesis is the muscles break down the protein breakdowns, and from the protein also the glucose is being formed, and from the fat also the glucose is being formed, and from in the liver the glycogen which is stored, so glycogenolysis is there, so glycogen is being broken down into the sugar, and then you can see this is the sugar. Then now the sugar is okay in your blood vessels. Insulin is not being secreted at this time because this is the requirement of our body. So the glucagon has done the job. It has contributed to the sugar, basically. So the similar way I have shown you here, how insulin is carrying the sugar molecule to the cells, and when there is not, then how glucagon is contributing to sugar level in the blood vessels. So with this background, I'll start what is diabetes. So diabetes is a condition in which your sugar increases in the blood vessels, be it any mechanism. We'll talk about the mechanism later on in our lecture, in our presentation, that how it is being accumulated. So now the sugar is being accumulated. Whatever you are eating, the sugar is accumulating into the blood vessel, but it is not being used by the cells. So when sugar level is rising in your blood, we call it diabetes. because the people say in the liberal language that I have a sugar disease. So this is basically diabetes is sugar disease. The sugar is accumulating in your blood vessels. So why it is accumulating? Because there may not be insulin or there may be resistance. I will let you later. I'll let you know how it functions, how it is being like accumulated into the blood vessels. But before that, I will let you know when how we diagnose the diabetes. When we say that patient is having a diabetes, so for this, I'll let you know when your fasting blood sugar, if you can see here, your fasting blood sugar is equal to 126 milligram per 100 ml or more than that on two different occasions, on two different, then only we label patient is having a diabetes. And if you have not given a fasting blood sugar, but your random blood sugar has been taken, and if it is coming greater than or equal to 200 milligram, possibility is that you have a diabetes, but we don't diagnose on this. Okay. So another comes oral glucose tolerance test. This is we give the glucose load, and every half an hour we measure the glucose level, and after 2 hours, if it is more than or equal to 200 milligram per 100 ml, then it is established that you have a diabetes. And another is HbA1c. Will go into the details about HbA1c also, but HbA1c is one. When it is greater than or equal to 6.5, you have diabetes. So if you have fasting blood sugar one reading with HbA1c greater than or equal to 6.5, then your diagnosis is confirmed that you are having a blood sugar, you are having a diabetes. So which diabetes we will talk later on. So what is glycosylated hemoglobin? That is also, I'll let you know, our blood contains RBC, red blood corpuscles, in which there is a hemoglobin molecule. So hemoglobin, you must have heard, it carries oxygen. It has various functions in our body. So glucose also stuck with our hemoglobin. So when there is a normal glucose level in your blood, this glycosylated hemoglobin will come normal. When much more glucose is available in the blood, it will be bind more RBCs, and then its level will increase. And the beauty of this test is that, because RBC lifespan is around 120 days. So this gives us the figure of whosoever the blood sugar molecule has been attached with this RBC, this will remain there. So this gives us the reading for 2 to 3 months, the how your sugar was controlled, how much sugar you was containing in the last 2 3 months. We can get a rough idea with HbA1c. With this, I'll let you know. There is another test we call C peptide test. This is basically when insulin is formed in our body, it is a byproduct, and when it is increased, then we see that patient is having. When it is low, then we see that there is no insulin and patient may have a diabetes. So diabetes is two types: type 1 and type 2. Type 1 is just 10% people have type 1, but most of the patient have type 2 diabetes, which is 90%. It is in 90% of the patients. And what is type 1, type 2? I'll let you know in details. You can see here type 1 diabetes. What is happening? Our pancreas is not able to make insulin sufficient to use the glucose. So there is no insulin, so it is type 1. So if there is no insulin, the treatment also involves giving insulin to the patients. But this is for the 10% people, 10% people and the younger age people, you can say. When there is no insulin, the sugar cannot be taken to the cells. The second diabetes which we are talking about was, it is type 2 diabetes. In this, what is happening? Pancreas is able to secrete insulin, but there is a resistance. This, because of this resistance, the glucose is not being taken by the cells, and the are starving for the glucose. They don't have the fuel to burn. So in this case, insulin is there, but there is a resistance. This is called type 2, and this occurs in 90% of populations. And this is usually the reason behind this is uh, obesity, lack of exercise, if you are overweight, if you are having hypertension, and some genetic role also is there. So this is the one. If we can change our lifestyle, we can delay this disease at least for a longer period of time. If even if we are having a risk factor, and even we can prevent it also at all, that we may not suffer with the type 2 diabetes in the life if we carry on with the healthy lifestyle, with a good diet and exercise. We may not suffer with the this type 2 diabetes. Type 2 diabetes, I'll, since it is in the 90% of the population, I'll let you know that, you know, out of four people I have seen, that one is only aware that they are having diabetes type 2. Three are unaware. You know, whenever they come to us with lot of symptoms relating to diabetes, uh, the symptoms are no doubt the polyuria, polydipsia, means you have having much more, passing much more urine in your, passing much more urine than you are dehydrated. That's where you are thirsty also. You feel hungry because even if sugar level is much more in your blood, but it is not being taken by the cells as a fuel. So cells are starving. They always say that I want glucose, I want glucose, and the body system is making more glucose, which I told you in the starving state how it makes the glucose in our body. So in all these are contributing much more, adding sugar to the blood, but it is not being taken. So what is happening about not only these symptoms, but I'll tell you, most of the people, they come with frequent infection. They come with the boils. Boil means there is a, uh, you can say, there is an infection of hair follicles, and recurrent hair follicles, recurrent UTI, urinary tract infections. People usually, especially the ladies, usually present with recurrent UTI. And then when we get the blood sugar done, we find that patient is having diabetes. So this is a one way of presentation also. So 75% population, they are unaware that they are having type 2 diabetes. Risk factor, I have already told you, the basically this is overweight, sedentary lifestyle, and if you have genetic predisposition like family history, you can develop type 2 diabetes. So now I am coming on the symptoms of diabetes, especially the symptoms which are I am enumerating right now is pertaining to type 1 diabetes. Because type 1 diabetes, there is a absolute reduction in insulin. So what is happening? The sugar level is there high in your blood vessels, but it is not being taken by the cells. So what is happening? The cells say that I want sugar. So there is breakdown of fat in your body, breakdown of your muscle in your body to make glucose, much more glucose molecule. So in this way, you are losing your weight. You are feeling much more hungry because cells are not sensing glucose. So you are feeling hungry. So in this way, what is happening? The I have written here polyphagia, means poly means a lot, and phagia means sitting. So you will have a feeling of hungry. You like to feed more, and you will be adding more glucose also. Second, the symptoms I'll explain you. Glycosuria. Glycosuria means there is a glucose in your urea, means urine. So glucose is coming in your urine. You know, when blood is passing through our kidney, the all the waste product is being filtered by the kidney, so that the product of utility can be reabsorbed by the body, and the waste product should be filtered out, and it should go into the urine, so that it should be get rid of the body. So when the sugar level is much more high in blood, there is a limit of kidney to reabsorb this sugar, because sugar, we want the sugar to be absorbed by the body so that we can use it as a fuel. But if it is a range, it is more than that, which the kidney can absorb, then it will spill into the urine. So when it is spill into the urine, there will be more urination. And when there is more urination, the glucose is coming into the urine. The glucose, tendency of glucose is to take water molecule with it. So there will be polyuria. Polyuria means much more urine coming, glucose is coming, and then uh, you are going a lot time, many times urine, passing urine, because glucose is taking water with it. So you are having frequent urination, and since you are having frequent urination, you are losing water from your body, so you feel thirsty also. So there is a polytipsia also, a lot of thirst is there. So these are the symptoms basically of diabetes. This occurs in basically in type 1, but in type 2 also these symptoms will be there. But type 2 have bizarre symptoms, which I have told you earlier also. So in type 1, we are seeing here there is no insulin, and then we are giving insulin therapy. Now, why it is important to manage diabetes? You know, if you will not manage your diabetes, your every cell in the body is hungry of glucose. They are not getting fuel. And with this, if they are not getting fuel, they cannot function well. And when they cannot function well, so it will cause sickness into the each cells. So our organs, various organs are made up of cells. So it affects each and every organ of our body. So it will affect your eyes, it will affect your skin, it will affect your heart, it will affect your blood vessels, it will affect your kidneys. So it will affect your brain everywhere. It will leave some sort of problem in the organ, because much more sugar is there in the blood. So with this, I'll let you know what is happening with our blood vessels basically. So blood vessels, when there is much more sugar is there, there is a hyaline arteriosclerosis. There the deposition in the lining the blood vessels, and this causing narrowing of the blood vessel, and this can lead to hypertension, high blood pressure. In the capillaries, the peripheral part, in the furthermost part in our body is made up of capillaries, to your tip of the fingers, your nose area, all this having capillaries on in the organs also, in the inner side, in the peripheral part. So their basement membranes also becoming thick, and they lose their elasticity. So and because of thickness, they cannot even absorb oxygen well. So there will be hypoxia. It can burst at any time. So these things, these changes are with the high sugar basically. And atherosclerosis changes also in the major blood vessels. There are always atherosclerosis changes, and wherever there will be atherosclerosis, the with the flow of blood, it sometimes get hurt over this portion, and then when it hurts, the platelets starts accumulating over there. So when platelets accumulate, this vessels become narrow, and then the blood supply to the further parts become less, and this causes a heart attack or stroke in our brain. This is the region. So diabetic are basically prone for all these changes. Second, I'll let you know how diabetes is affecting our eyes. I have just taken the major organs which is affecting diabetes basically, which is being affected by the diabetes. However, it affects all over the body. It starts in the eye, changes start from front to back basically. In the front there is a lens through which your that light rays passes and image forms on the retina, and then we are able to see any image. So with this diabetes, this becomes opaque, so the cataract will be much more in the diabetic people, early age cataract, and they will be prone for having a cataract. And then there is changes in retina. Retina is the screen, we say the screen of the eye where the image usually forms. So then this, I have told you the changes in the blood vessel. Due to that, there's a cotton wool exudate, and the hemorrhage, blood is oozing because capillary is being burst over there in the peripheral part, and the blood is oozing over there. So this causes our decrease in vision and lot of symptoms basically. So how it affects kidney, how it affects your nerves, I will let you know in the one slide only. You know, in the kidney also, the blood is which is flowing as being damaged. This glomerular, this afferent arteriole is being damaged, and basically it causes nephrotic syndrome, nephritis. Basically, we say diabetic nephropathy. And basically, if you have a blood sugar more than 10 years, 10 to 30 years, you are bound to develop kidney changes. And if your sugar is not controlled, that you may develop early these changes, and this is a leading cause of dialysis and, in and over the globe. Patients usually go for diabetes who are basically diabetic because their kidney is being damaged. Similar way, our nerves are being damaged. So what is happening when our nerves is being damaged? You don't feel sensation. So when you will not feel sensation, you know, like if you are walking barefooted, or maybe you are taking a, shower with a hot water, or maybe you are taking bath with a bucket of water which is warm, and when you put your fingers, how much warm is the water? Usually we feel, if it is much more high, we feel it. But the diabetic people, what is the problem? They lose that sensation because there is neuropathy, and they don't feel much more hotness of water. So they usually come with a burns also, that their hand is burned, their foot is burned, their face is burned when they are taking shower. And when they are walking barefooted, they come with some stone or somewhere, like, so their shoes is having some problem, then they get some ulcer. And they don't notice because they don't have pain, because they are not feeling that pain. And what is what is there, when they see oozing blood from their toes, then they realize that they have hurt their toes. So then we say they have developed diabetic foot, because sugar is very high in the blood, and this let the bacteria grow very well. And when the blood is oozing, it doesn't even clot on the time, and the infections are always there. So we become a diabetic foot ulcer when it hurts. So when there is an infection, then that might be that we may require to amputate also, if there is a gram negative infections over there, and infection in such a level that we cannot preserve that part of the foot, then it requires to be amputated also. So these are the side effects basically of complications basically of diabetes. So treatment, what I will come to know about the treatment. Treatment for type 1, which is 10% only, is the insulin, because insulin is not being secreted by the body. So type 1 diabetes, they require insulin. And for the type 2 diabetes, if you can manage very well your lifestyle, we have dietitian here today. She will explain you much more about the diet. But if you can control your weight with the diet, if you can exercise very, if you are having a risk factor, your parents in the family, suppose in the parents, your mother, your father, they have diabetes, so you are prone to develop diabetes, and you should take care of your weight and your lifestyle. So for diet, though our dietitian will be telling, I'll just give you the brief idea that if your calorie requirement is 2000 kilocalorie in a day, you restrict 400 kilocalorie. You just stick to 1600 kilocalorie. You should not take much more kilocalorie. You should not take sweets, any item which has much more carbohydrate level. Or for that matter, I'll tell you, anything which is being grown under the soil, except onion, garlic, and ginger. All the things, potato, sweet potato, anything which is growing inside the soil will contain much more carbohydrate, and you should avoid all these things. You should avoid sweets. You should go for a regular exercise. For control of diabetes, you should go for 5 kilometer walk in a day, at least 6 days in a week. And you should consume only healthy diets with less carbohydrate, less fatty meals. And if you are already diabetic, then you must take your medicines regularly on the time. Whatever medication your doctor has given, you must take. I have seen people coming, patients coming in my OPD, and uh, their sugar is very much controlled. When I say I am very happy with your sugar, you have controlled very nicely, and then they when they come next time, some of them, they are having high sugar. I said, why you are having high sugar this time? Have you taken care? Uh, Usually the sugar patient, they don't say, but their attendant usually tell us, no, no, doctor, he's having sweets at the home. He's taking much more diet nowadays. He doesn't go for walk. He said that my sugar is controlled. Doctor has told me my sugar is controlled. He is not taking care. So for to complication which we were talking about right now, if you will be adhere to your diet and lifestyle, and if you adhere to your medications, even if you are diabetic, you will not develop complications, and you can if you will develop also, you can delay your complications. So it is very necessary that you make a uniformity and consume the diet according to your requirement only, and you do not miss your doses of diabetes medicine, and you should take regularly on the time those medication, whatever the time you are taking. The always is it's better to take on the breakfast table. If you are on a breakfast table, you will keep your medicines, you will not forget to take it. So if you are taking one time, take it after breakfast. If you are taking two time this medication, take it to breakfast and your dinner, keep it there only. If you are taking three times also, so you keep with your food this drugs, so that you can take on in the time of lunch also when it is required. So I'll tell you a little bit about the insulin therapy. Type 1 people, they are taking insulin, and type 2, very few people, they also require sometimes to take insulin. There are certain conditions when we give insulin to them also. So anybody, and in your family also, if somebody is taking insulin, I will suggest you something. That there are chances that they might develop hypoglycemia. The symptoms for hypoglycemia is that weakness, hunger, shaking, loss of consciousness, seizure. And I'll tell you one thing more. High sugar in your blood will take years to cause complications, but low sugar in your blood will immediately cause symptoms, and it's a very it's a prevalent cause of death basically. It can cause even death also. So hypoglycemia is a condition that you must take care of. Whenever you are taking insulin, you must take food. Sometimes I have seen patients that they take insulin, and there is some argument in the family, and then they have not taken food, and then the patient attendant bring them, and then we find that the patient is having hypoglycemia. So basically, whenever, if you are not taking, if you are, even if you are fasting, you are not going to take meal, please don't take insulin. That dose of insulin should be avoided. And if you are taking insulin, which is has been whatever amount has been advised by your doctor, then you must take food. And if you feel all these symptoms, it's better to give a sugar syrup. uh, have chocolates, have sugar, immediately have sugar. You can have any glucose solution also immediately, because little rise in sugar will not cause any problem. But of course the low sugar can cause, it can be fatal also. So I have told you about the type 1 and type 2 diabetes. Type 1 we cannot prevent because this is an autoimmune disease. There is a destruction of the pancreas which secretes insulin, and because the rat we require to give insulin, it cannot be prevented. These people are usually lean and thin. They have a less weight, and uh, even if they are maintaining their diet very well also, they develop this type of diabetes because their insulin is not being produced by the body, and this cannot be prevented. But of course, the 90% uh, diabetes, which is type 2, can be prevented very well by a healthy lifestyle. So whenever uh, you are I can tell you one thing more, that in the global load, the diabetic patients are much more over the globe. In India also, I have seen now, usually people used to say earlier that it's a disease of rich people, but it's not like that. It is developing because our lifestyle has changed. uh, in the earlier life, even the workers used to go by they used to walk to their workplace, or they used to go by cycle. But nowadays, everybody goes taking some transport, and they don't have work. Pressure is so much, they're always busy in work. They don't even they are not even taking the ready made food from the home. But what they are doing, whatever readily available in the market. Even for the labor people also, I'll say, if chole bhature is there, they say, oh, 15 rupees, 20 rupees plate I am getting, and they eat chole bhature. They don't know how it will be causing the problem in their life. But then this is a region in the lower socio-economic group also. Nowadays the diabetes is very common. So we have to overcome this by our healthy lifestyle, and taking a proper diet. So if you will be taking a proper diet, and if you will be exercising well, I'm sure that you will not develop, even if you are a diabetic, you will not develop complications. Even if you will develop a very later in the life, in a very late stage. With this, I'll finish my presentation, my lecture. If any question is there, it is welcome.
Sure. Thank you so much, sir, for sharing your valuable insights and your management techniques on better control of blood sugar levels. Uh, there's one question that is for you, sir, as of now, and we have few other questions which is related to diet. We'll cover those questions after Ms. Vanshika's presentation is completed. Sir, the question is there any other possible way without taking insulin per type 1 diabetes?
See, for type 1 diabetes, I already told you that our pancreas, from where the insulin is being secreted, has been destroyed by our autoantibodies. What we call autoantibodies, there are antibodies in our body to fight against the infections. So sometimes our body doesn't recognize in some people that this is their own organ. So what is happening? This antibody destroys the pancreas, and when pancreas is destroyed, the insulin is not there. If insulin is not there, you have to take insulin. There is no way that you can get rid of diabetes without taking insulin if you don't have insulin. I can make you understand. You want to make a chapati, but you don't have a wheat flour with you. You won't be able to make chapati. Only water, only tawa, only gas will not make chapati. For chapati, you need a flour at least. Be it a maida, be it a wheat flour, or whatever it is, you require something to make a chapati. Similar way, insulin is required to control your diabetes. So type 1, yeah, I will say you, there are so much advances nowadays that every time which you are taking insulin, the work is going on that you can implant a part of pancreas in your body somewhere. It is usually in the forearm, they implant it. And this is bovine. So only thing is that when we bovine means the any is from the cattle basically. So when you are taking that pancreas, there is chances that this will not be recognized by our body, and body will make autobody against that also, and it will be destroyed. So the research are going on for to make a synthetic pancreas also, similar to our HLA. And if that will be there, then it might be possible that for some time you will not be required to take insulin, and it will work as a insulin source in your body. The As far as nowadays the bovine pancreas which is being implanted in our body, and that takes care for depends upon the size, but takes care for 3 months to 1 year if it is not being rejected. Then you otherwise we have some delay release insulin also that has to be implanted also. But these are all under research and not very useful. I can say that whatever your doctor has advised you to stick on that at present. For type 1 diabetes, you have to take insulin. and you must take insulin and must take food with insulin. If you'll not take food with insulin when you are taking injection, you might develop hypoglycemia, which I have already told you.
Sure. Thank you so much, sir. So, another question is, these days we speak more about reversal of diabetes. Is complete reversal possible with effective diet? And another question is based on the same lines, that please tell us something about sugar reversal programs. We see the advertisements these days online. Are they really effective?
I'll tell you, we in MeraDoc, we are running a condition management program also, in which we take care of the chronic conditions basically. So it is very much possible to revert your sugar, but depends how much resistance in your body with insulin is that. So the reversal program is basically for type 2 diabetes, and type 2 diabetes, which is in the 90% population. Sangha, I think you have to mute your mic. So, so for the 90% population, type 2 diabetes there, if your HbA1c is around 7 or 8, up to 7, we can revert it by the lifestyle changes or by the diet management. But if your HbA1c is very high, it is more than 10, you might require insulin also initially, and then you come to the will come to the medications, and then diet control will control it. So it depends upon how much level of sugar in your body is there. But if you are having a risk factor and you are pre-diabetic, which means you are not coming, your blood sugar in the blood is not up to that level that you can, that we can classify you as you are having a diabetes. But it is not normal also, but it is raised. Like for the fasting blood sugar, I told you, when it is more than or equivalent to 126 milligram per 100 ml, you have diabetes. But if your sugar fasting should always be less than 100. But if it is between 100 to 125, you are pre-diabetic. So you can revert your sugar very well. You are the best candidate to revert your possibility of diabetes with the this condition management program. And secondly, if your sugar is not much more high, then also, if you'll take precautions in your diet, and the guidance with our condition management experts, like they will guide you how to go about the exercises. Our dietitian will tell you what diets you should take. Then the possibility that you can revert your sugar. So it depends upon the actual the level of sugar in your blood.
Sure, sir. Thank you so much, sir, for answering those questions. So, Dr. Sanjay, another question that we have, which is not specifically related to diet, is how stress affects the sugar level.
I'll tell you, this is a very good question basically. You know what is happening whenever there is a stress? Lots of hormone is being secreted from our body. One is adrenaline. Wherever there is a stress, adrenaline is being secreted. Glucagon, which I hormone, which I told you, cortisol. This is kind of a steroid. Our body also makes some steroid. People usually say corticosteroid is bad, but corticosteroid for some patient, I'll tell you, is basically moon. You know, all these things are required our body. So whenever stress is there, these hormones level increases, and when these hormones are being secreted from our body, so they start gluconeogenesis. Gluconeogenesis is a condition, is a process in which glucose is being generated from your protein, from your fat, and even glycogenolysis is being occurring. So glycogen is being break down into the glucose. So whenever stress is there, the sugar level will become high. So if you are under a stress for prolonged period of time, you might develop diabetes. So thing is that for a shorter duration, period of stress will not harm you. It will not lead to diabetes. But if your personality is like that you are always in a stress, and you are having a risk factor, genetic risk factor for developing diabetes, and you are overweight also, then this all will accumulate. This all will come together and will cause the diabetes.
Sure. Thank you so much, sir, for explaining that in such detail for us. Okay. So another question that we have, and a very interesting one, that is intermittent fasting good for diabetes patients?
I'll tell you, mm, intermittent fasting. Are you able to hear me?
Yes, sir.
Uh, yeah. So I told you little bit. I'll tell you about the diet in between when Vanshika is not there. So in diabetes, we say you take frequent amount of diet and a smaller amount and frequent intervals. Uh, you should take your breakfast at the time. Uh, what time you take in the morning? You should have to maintain a very good circadian rhythm. What I mean to say that your diet should be on time, and your diet should be as per which we have you suggested you, and your sleeping pattern, your exercise, everything should be on time. Because if you sleep at 8 o'clock every day, or 10 o'clock, sorry, at 10 o'clock basically every day, and you wake up at 6 o'clock, there is a circadian rhythm in our body. So if the body prepares our body to wake you up, it's kind of alarm. When you set an alarm in a watch to get up in the morning, suppose you have to catch a flight or you have to go somewhere, you just put an alarm that I have to get up at 6 o'clock. So 5 o'clock I will put an alarm and I will get up. The body have an alarm system by the hormones, all these things. So if you are getting it, sleeping at 10 o'clock, get up at 6 o'clock, your body start functioning at 4 o'clock to make you awake. uh, but if you sleep at 12 o'clock someday, at 10 o'clock someday, at 2 o'clock someday, and getting up at 6 o'clock, and your circadian rhythm is destroyed. This is also important, the same with the diet also. So you have to take morning diet at your time, because this has to maintain, the body has to maintain the cycle. And it's a good practice that you must take your breakfast at 8 o'clock, and you take your medicine if you are taking your medicine for diabetes. 10 o'clock you can take either you take a tea or lemon water, whatever you like, as per your preference, whatever you feel, with biscuit or with some salad or whatever way you want, you should take. And then you should take lunch on your time, and then evening tea also you can take at a time, and night also dinner at a time. So this is the way you can make your body accustomed how much insulin to be secreted by pancreas, and how medicine has to work with the time. You are setting, you are giving a goal to them, and every day they are functioning on that goal. So if you will do intermittent fasting, whenever you are fasting for more than 8 hours, your other the hormones which I was enumerating for the stress also, these are being secreted during the fasting hour also. The glucagon, the cortisol, the adrenaline, these are being secreted. So what is happening? So if you will be prolonged fasting, prolonged, this will add on to your sugar. There are two things we call, when the patients are taking insulin, we detect soma gai and down effect, we call it in a scientific way. What is happening? People say that early fasting their blood sugar is high. You know why? You have taken diet and that was rich in carbohydrate. Okay. Or sometimes you are taking diet which is low in carbohydrate, and that not on time. So at 3 o'clock or 4 o'clock, if it has been digested at insulin, your insulin has worked, your sugar level goes down. But this is being sensed by our pancreas, and the glucagon is being secreted because the sugar level is going down. So that what will be happening then, again these hormones will be secreted, and your sugar level will increase in blood to give you the more sugar. So then your early morning sugar will become high. So intermittent fasting is not good. I'll suggest you stick to a diet pattern if you are diabetic. Not go for intermittent fasting. This will not contribute much more. But if you are taking a low amount of calorie, and exercising well and on timely your meal, this is going to be helpful.
Sure, sir. I hope this answers the question well asked by one of our viewers. There are a few more questions, but we would be taking up all those after Ms. Vanshika has shared her insights on dietary management. So please stay tuned and we would be answering all your questions for sure. So, Ms. Vanshika, over to you if you can please bring up your screen.
Hello everyone. As Dr. Sanjay awared all of us about diabetes, its clinical causes, symptoms, etc. Similarly, I am here to let you all know how dietary factors can lead to diabetes, and there are certain guidelines and managing tips and tricks can prevent diabetes and treat diabetes. Well, we have often heard that if you are diabetic or prone to diabetic, please don't skip any meal, especially breakfast. Maintain proper meal gaps. Try to avoid added sugar, etc. But many of us don't know the reason behind these instructions. Well, whenever we skip any meal or don't maintain proper meal gaps, energy deficit, fatigue, and dehydration occurs. And whenever we have our meal, we either tend to eat too much of food due to hunger, or a wrong kind of food like junk food, or the food with higher amount of carbohydrates in it, which eventually raises the blood glucose level in our body. So this is the reason why we should not skip any meal or maintain proper meal gaps. Now, the reason behind avoiding or limiting added sugar is that it's nothing but a extra amount of glucose or a fructose which after adding in our food can increase the glucose level in our body as well as uh, which eventually increases the blood glucose level in our body. Now, let's talk about the food choices and dietary management tips to prevent or treat diabetes. So, those who are diabetic or are prone to diabetic have to choose maximum amount of food items which are less than 55% of GI. Now, let me tell you about the GI, which is glycemic index. Glycemic index is a measure of how quickly a food can make your blood glucose rise, as it only contains food having carbohydrates or more carbohydrates other than any other nutrient in it. In short, glycemic index is just a range that reflect about the amount of carbohydrate a particular food contains. Similarly, we should choose non-starchy vegetables than starchy ones like broccoli, spinach, green beans, etc. Try to limit processed foods and should go for refined carbohydrates. The reason behind choosing them is that carbs is whenever we have any carbohydrate food, it when it's not get digested or are in a higher amount, it will then deposit it as a glucose in our body, which is eventually increases blood glucose level and further uh, uh, will further go for the another clinical conditions as well. So this is what you should. Being a dietitian, I would suggest for to go for a high fiber diet rather than for the carbs diet. You basically you should not need to restrict somewhere, but you should maintain your portion size of your food. You should go for the food which are high in fiber, as high fiber food can helps you uh, uh, digest your food in a particular way, and can even help you for energy sources which we can often taken from carbohydrates. But if you are diabetic, you should avoid carbs. So this is the reason we should go for this kind of diet. uh, I hope you have got what I have tried to convey. With this, I would like to end my presentation. Thank you everyone for listening.
Thank you so much, Ms. Vanchika, for sharing your inputs and valuable insights on dietary management. We'll be taking up the questions now, and we might exceed the time a little bit, but please stay tuned to get answers to your questions. We'll be covering all those now. So, Miss Vanchika, the question is how much amount of sugar intake is safe?
वेल इट्स डिपेंड अगर आप जैसे डायबिटिक है या फिर आपको प्री डायबिटिक स्टेज है तो आपके शुगर का अमाउंट अगर हम नॉर्मल एडिड शुगर की बात करें तो हमारे आपके 6 to 7 टीस्पून जो कि आपके अप्रॉक्सीमेटली हो गया 25 to 30 ग्राम्स, ठीक है, उससे ज़्यादा आपका नहीं होना चाहिए। ये तब की स्टेज है जब आप नेचुरल शुगर्स भी साथ में ले रहे हैं। नेचुरल शुगर्स में आपके आगे जैसे आप फ्रूट्स के थ्रू ले रहे हैं या फिर आपके गुड़ हो गया, ये सब चीज़ें जैसे आपके सीड्स नट्स वगैरह ये सब चीज़ें हो गई। इनसे ये नेचुरल शुगर्स के साथ साथ अगर आपको एडिड शुगर लेनी है तो इससे ज़्यादा आप नहीं लेंगे। और अगर नॉर्मली आप डायबिटिक नहीं है और नॉर्मली अगर आप ले रहे हैं तो आपके लिए सेफर 9 to 10 टीस्पून विच इज़ 35 to 40 ग्राम्स मैक्सिमम।
Okay, sure. Next is my question is to the dietitian. Is eating regular intake of natural sugar like jaggery, about 50 grams, and dates, 4 to 5, can also increase the diabetes risk in future?
वेल नेचुरल शुगर्स ज़्यादातर रीज़न नहीं बनती, बट ये रीज़न तब बनती है जब हम इसको कोई भी चीज़ अगर हम ज़्यादा अमाउंट में लेते हैं। बिकॉज़ जो हम जैसे आपने जैगरी की गुड़ की बात करी या डेट्स वगैरह, ये सिर्फ़ इसके अंदर सिर्फ शुगर नहीं है, और भी बहुत सारे न्यूट्रिएंट्स हैं। और सिमिलर वे में अगर हम किसी और फूड आइटम की भी बात करें, तो उसके अंदर भी शुगर के अलावा भी जैसे रूटेड वेजिटेबल जो मैंने बताया नॉन स्टार्ची हम लोगों को लेनी चाहिए स्टार्चेस, इनके अंदर और भी न्यूट्रिएंट्स होते हैं। तो अगर हम इनको एक्सेस अमाउंट में ले रहे हैं तो सिमिलर वे में ये भी कहीं न कहीं हमारे को इफ़ेक्ट करेंगी। बट अगर हम नॉर्मल अमाउंट में हम ले रहे हैं तो ये कभी इफ़ेक्ट नहीं करेगी, बिकॉज़ उसके अंदर एक्स्ट्रा न्यूट्रिएंट्स भी है जो और अलग वे में हमारी बॉडी में हेल्प कर रहे हैं। तो जो एक ग्लूकोज़ डिपोज़िशन होता है वो नहीं होगा एक्स्ट्रा अमाउंट में, तो वो कभी इफ़ेक्ट नहीं करेगी। बट हाँ, अगर आपका अमाउंट इंक्रीज़ है या फिर आप ज़्यादा वे में जैसे अगर आप अभी आप कह रहे हो कि आप 50 ग्राम ही ले रहे हो, लेकिन उसका आप इंक्रीज़ कर लो, किसी और फ़ॉर्म में आप एक्स्ट्रा कुछ ले लो, तो फिर वो डेफ़िनेटली आपको इफ़ेक्ट करेगी।
Sure. Thank you, Ms. Vanchika, for explaining that. Next question is for Dr. Sanjay. Will insulin make me gain weight?
Yeah, insulin. Wherever the insulin injection is giving, there is the changes in the adipose tissue. So slight increase in weight is there, but not much more. If you'll take insulin and exercise well, it will not contribute to the additional amount of weight gain. But of course, yeah, insulin is definitely have some effect on the weight. Uh, uh, but with regular exercises, it will not affect you.
Sure, sir. So the next question is how to take precaution for eyes.
Pardon?
How to take precaution for eyes.
Eyes. Okay. So I'll tell you, uh, for eyes or for kidney, for your heart, for your brain, the principle is same that you have to maintain your sugar level. If you are diabetic, then if you are a type 1 diabetes, you should take insulin amount which is required, and you to stick to your diet and exercise. And for type 2 also, you stick to your medication and diet and uh, stick to your exercises. This is required. But in the meantime, I'll tell you, the sugar level affects each and every part of the body, which I suggest you. But we say to the sugar patient that every year they should get their eye checked. Eye changes are earlier. Eye changes come earlier than even the kidney changes. So, if yearly you will go for your eye checkup, then you will come to know whether your eye is developing symptoms or not, and if there are any changes are going to be there or not. You will come to know. So your even probability of cataract, which I told you, that you will come to know. Your retina will be examined by the eye specialist, whether there are some changes in the blood vessels or not. So, if you will control your sugar, these complications will no doubt it will be delayed. If you will not control your sugar, the eye changes will come 3 to 5 years in 3 to 5 years. But if you will control your sugar, it might come after 20 years or 10 years, or maybe after 25 years, or may not come at all if you'll control your sugar very well, and you get your eye examined every year. So you must get your eye examined. For the similar way, I'll tell you for the kidney also, you get your blood test done, HbA1c. When you get your every 3 months, you get your sugar, blood sugar, HbA1c done, and you get your urine checked for protein. Usually the protein are not being filtered by our kidney. Whenever there is a changes in our kidney, this filtration material also become affected, and then they filter protein also. Protein are larger molecule. They are being absorbed, they are not being filtered by the kidney. So when there is damage to this filter, this sieve, you can say, like when you like for the tea also, the tea leaves are being screened by the sea. The same way the proteins are being not being filtered by the kidney. But when kidney will be affected, the protein will come in the urine. So earliest sign you will get before the further kidney damage, you will get the protein is coming into the urine. So you get your urine test done for protein, or we call it a one more test, specific test, urine for microalbumin. Microalbumin is the smallest part of the protein in our body. If it is being filtered, that means there is some changes started in your kidney. So you get this done also. You get your ECG done regularly, because I told you, even the heart. I told you that there is a neuropathy in diabetes. You don't feel sensation. So the greatest cause of silent heart attack is diabetes, because you don't feel pain, because your nerves are damaged. So even if the heart is struggling for oxygen, they are not getting supply, but you are not getting pain. So you get your eye examined every year, and you get your blood sugar checked. You will not develop any complication, be it a eye, be it a kidney, or be it your brain stroke, be it a heart attack, anything, be it a skin changes. You can delay it, or you may not develop it.
Sure, sir. Thank you, sir. Another question for Ms. Vanshika. Does tea put any effect on diabetes? Having tea.
वेल सिर्फ चाय के अंदर एक ही चीज़ है जो आपको इफ़ेक्ट करती है, जो कि है शुगर। क्योंकि बहुत सी स्टडीज़ हैं जो बताते हैं कि चाय एक ऐसी चीज़ है जो आपकी ब्लड ग्लूकोज़ को मतलब मेंटेन करने में, इंसुलिन लेवल को मेंटेन करने, जो आपकी प्रॉब्लम है इसको मेंटेन करने में, इनफैक्ट इसका इम्यून सिस्टम भी ये बूस्ट करती है। तो इसका कोई डायरेक्टली इम्पैक्ट नहीं जाता अगर एक लिमिटेड अमाउंट में है और उसके अंदर अगर शुगर कंट्रोल है प्रॉपर्ली। लाइक आप ऑब्वियसली अगर आप डायबिटिक पेशेंट है, मैक्सिमम लोगों को यही कहा जाता है कि आप शुगर एडिड शुगर मत डालो। उसका रीज़न ये होता है कि अगर आप चाय भी पी रहे हो तो वो आपको नेगेटिवली इम्पैक्ट ना करे। बिकॉज जब एक टेस्ट वाली चीज़ आ जाती है तो हम कोशिश ये करते हैं चलो कोई नहीं, थोड़ी सी बात है, हम डाल लेते हैं शुगर, तो तब वो आपको इफेक्ट करेगी डेफिनेटली। बट हाँ, आपके वो अमाउंट भी एक कंट्रोल्ड है और साथ में आप एक पर्टिकुलर टाइम पे लाइक 2 टाइम ही पी रहे हैं चाय, तो आपको कोई इफ़ेक्ट नहीं करेगी। इनफैक्ट वो पॉज़िटिव वे में ही जाएगी।
Sure.
The question was on
Another,
seafood or what? Seafood?
sorry, sir.
टी, चाय,
Question was on seafood?
Tea, sir, tea.
Tea,
चाय।
okay.
So another question, Ms. Vanshika, that some people consume some natural remedies like some plant roots, which reduces the blood sugar drastically. Is it recommended?
वेल ये समटाइम्स कह सकते हैं पॉज़िटिव वे में भी, बट नेगेटिव वे में भी। एग्ज़ैक्टली मैं खुद ये चीज़ रिकमेंड कभी नहीं करती। बट इफ़ कोई ले रहा है, जैसे मैंने कहा कि एक पर्टिकुलर पोर्शन, एग्जैक्टली मैं भी नहीं कहूँगी क्योंकि मुझे इतनी नॉलेज इससे रिलेटेड नहीं है टू बी ऑनेस्ट। बट हाँ, जितना एक्सपीरियंस वाइज मैं कहूँ कि रेमेडीज़ अच्छी होती हैं। और ऑब्वियसली अगर जैसे आपने अभी बताया कि रूटेड वो कुछ जो भी था, सॉरी आई हैव नॉट हर्ड क्लियरली।
Roots, yes.
रूट्स, हाँ
Plant
एग्जैक्टली,
roots. Yes.
प्लांट रूट्स, तो वो इफ़ेक्ट एकदम नहीं करेंगे जितना मुझे पता है। बिकॉज हम लोग अगर कोई भी वेजीज जैसे ग्रीन वेजीज लेते हैं तो उसके अंदर भी लीफी पार्ट है, तो हमारे एकदम कोई इफेक्ट नहीं आता एज सच। बट हाँ, एज आई सेड कि वो कितने फाइब्रस है, ठीक है। हम कार्ब्स को तो कम कर रहे हैं उसके अंदर, लेकिन उसके अंदर कितना फाइबर है, क्योंकि सिमिलर वे में हमारा कार्ब्स क्या एनर्जी के फॉर्म में हेल्प करता है, सेम वे में आपका फाइबर भी हेल्प करता है। तो इसलिए हम रेकमेंड करते हैं कि आप फाइबरस फॉर्म में ज़्यादा लो, कि आपकी एनर्जी मेंटेन रहे और वो चीज़ आपको इफेक्ट ना करे। तो मेरा बेसिकली यही, जो मुझे जितना समझ में आया, ये रीज़न है। बाकी मे बी सर बेटर वे में बता पाए अगर।
See, whatever plant root you said, uh, in allopathy, we don't recommend anything other than your actual diet control, because we are based on scientific reasons only. So these things, we actually, I am not aware about the plant roots. If somebody has some data and some knowledge, they can, if they have known that it affects, they can use that. We are not preventing anybody any sentiments which they want to use. But the key goal of to control diabetes, I'll tell you must, that your calorie requirement should be less. You should exercise well, then only you can control. Because type 2 diabetes, I told you, which is in 90% population, is because of the insulin resistance. And why there is insulin resistance? Because you are overweight, obesity is there, the fat is interfering with your functioning of insulin, all these things. So try to take diet which is lesser in calorie, so that you should not develop much more, you should not deposit fat in your body, and exercise well. This is the key goal to control the diabetes, which we are seeing in my even career in 32 years. I have seen people controlling very well with the diet and exercise. And but if there's somebody says ki I want to take karela juice, or I don't tell them don't use whatever way if you want, because we don't have that scientific knowledge with us. We don't have, in allopathy we don't know about all these things. So we either we don't say you take, or we don't say no take. If your conscience allows to take, you must take. But at least stick to whatever the diet which I have told you, whatever medication which I have told you, or whatever exercise I have told you, you stick to that. For that diet also, I will tell you to know, you include much more salad and green vegetables in your diet to control the diabetes. So even suppose you take four chapatis in your lunch, so try to take two chapatis. In dinner also try to take only two chapatis, not more than that. And rice you should not take. But if you are very much that you will not be able to be without rice, then take a smaller amount of rice. And that too, I will tell you, once or twice in a week, not every day, because this will definitely will give you the carbohydrate load to your body. So take in that way, and include much more salad and green veg. You believe me, when you will start taking all these things now, initially you may feel that you are feeling hungry and you are not very much satisfied, but later on you will be very happy, and you will be trying to take this pattern of diet only, because this will give you the satisfaction. Because our body is so that it accustomed very well, whatever the way we put our body. If we'll put our body in every day 50 kilometer of running, though we will feel very lazy if we are not running a 5 kilometer or 10 kilometer in a day. Similar way, if we are having food much more, every day we are having six parathas, and lunch also very high, then you will not be satisfied with a smaller amount of food. But once you will stick to a smaller amount of food, you will be satisfied in that small amount of food only. Believe me, you try this, you will come to know. Because our body is very accustomed. It can accustom very well the way you will the give challenge to the body.
Sure, sir. Thank you so much for explaining that in such detail. Since we have shortage of time, we would request everyone that if there are any unanswered questions from your side, we would be happy if you can reach out to us. I will our official email ID. You can reach out to us, and we would be happy to answer all your questions. We would be taking up the last question now. So the question is: should I check my blood sugar levels at home with a glucose monitor, and how often should I check them?
See, you can check with glucometer. There is no harm checking with glucometer, but I'll tell you one, two, three things with glucometer. Whenever you are checking your blood sugar with glucometer, Just take your glucose strips. Either they are they should not be overdated, because this will give you the wrong reading. It should be within the use period that strip should be used. And secondly, uh, the sugar level depends upon how often you should check, depends upon how bad family history you have. If you are having a family history of diabetes, then you must check your blood sugar on every 3 months. Okay, if you are 35 years and older. So, and if you don't have a family history, and if you are living a healthy life, you are not consuming very junk food and food which is very high in calorie, high sugar content, then you might check it on every 6 months also. But if you are taking, you are living a sedentary lifestyle, your family history is there, and you are taking even diet also much more chocolates, much more sugar, sweets, then at least you check even monthly also, because then you might not when you will develop sugar. If you are not exercising, you are taking a heavy diet, then you should check monthly with glucometer also. And if it comes high with glucometer, then you must get a check from the lab, the fasting one and HbA1c both.
Sure. Thank you so much, sir, for answering that. We now, I'm just quickly sharing a quick number for you all over the screen. As you can see, you can reach out to us on this number 1800 3090 101, and you can have all your questions answered. We would be really happy to help you. And with this, we also want to introduce you to MeraDoc's declining diabetes program, which has been mentioned by Dr. Sanjay as well during the webinar. This is run under your family physician's team with a complete cover of diet plan, medical cover, exercises, your progress tracking, your taking care of your medicines, your lab tests, and even your family members. So you get all the benefits that you can expect from a program, which will help you in managing your blood sugar levels well. So if you have any questions regarding the program or any other ways, if you have any questions that you want to get your answers to from our expert panel today, you can reach out to us. We would be really happy to answer all your questions. So with this, yes, sir.
One thing more I want to mention in my previous question, which I answered. I have answered for all the non-diabetic people basically, but I will tell you, if somebody is diabetic and somebody is having taking insulin, they require to check before taking their meal. Insulin, they require to check to be checked their sugar before meals also with glucometer, and they can adjust their dose of insulin according to that. For type 2 diabetes also, monthly is good enough. If they are taking a proper diet and proper medication, monthly is good enough for diabetic people. Actually, I answered for the non-diabetic, so I thought I must mention for the diabetic people also.
Thank you, sir. So considerate of you. So, with this, we come to an end to today's webinar. Thank you so much, everyone, for joining in. We understand you have so many questions specifically on diet and your measurement of blood sugar levels. You can reach out to us at any point of time. You can check our website. You can talk to our experts, and we would be really happy to answer all your questions. Please stay tuned for further updates on other webinar that we would be conducting, and keep your questions ready. Thank you so much, Dr. Sanjay and Ms. Vanshika, for coming on the panel and making us understand about diabetes.
Thank you, Sangama, and thank you to our audience, they, for the patience listening. Thank you so much.